Chapter 1, Code Blue at Midnight, from the Medical Mystery Collection of Dr. Everett Cain. The hospital sighed, its walls holding secrets that no one else could hear. Dr. Everett Cain, a seasoned diagnostic pathologist, had spent years learning that truth was rarely loud, it whispered. On that night, he chose the ICU for its quiet, where he could think. He was reviewing cold case charts when the intercom broke the stillness. Code Blue, room 417. Repeat, Code Blue, room 417, 1:04 a.m. Inside, the scene was chaotic but controlled. Nurses worked with precision, and a young intern stood frozen by the crash cart. The patient, Harold Granger, was a 62-year-old who had recently undergone coronary bypass surgery. He was supposed to be discharged soon. Now, he was flatlining. Cain immediately took charge. He examined the body. No response, no color. But then he saw it, a tiny puncture mark on Granger's neck, a syringe or butterfly needle mark. Granger was declared dead. As the room emptied, Cain lingered and noticed a photograph and a Bible beside the bed. A sticky note poking out Psalm 23, for when the storms come. Cain murmured, "You knew something, didn't you?" Later that morning, hospital records office. Cain requested Granger's logs. Everything was too clean until he found it. An unlogged order for succinylcholine, a neuromuscular blocker under Dr. Philip Halverson's name. Halverson wasn't even on the floor that night. Dr. Halverson, staff lounge, 6:32 a.m. Cain confronted Halverson. The young surgeon was cocky and relaxed, but the accusation landed hard. "You visited Granger last night. Why?" Cain asked. Halverson's expression tightened when Cain mentioned the succinylcholine. "That's a serious accusation," Halverson said. Cain didn't flinch. So is murder. Cain had already submitted for a tox screen. Halverson was in trouble. 3 days later, tox results. The test came back positive for trace amounts of succinylcholine, enough to cause paralysis, to mimic cardiac arrest. Cain turned to Nurse Harper. "Notify risk management." The news breaks. 1 week later. Halverson resigned quietly, placed on administrative leave. No one mentioned the motive, but Cain had pieced it together. Granger had been a witness in a review involving Halverson's brother. His testimony meant exposure, and Halverson had decided to silence him. The quiet aftermath. Rooftop garden, 7:42 p.m. Cain sat with Nurse Harper in the rooftop garden. She handed him coffee. They shared a comfortable silence. "You think he knew?" she asked. Cain nodded. "Maybe not the how, but definitely the who." Harper smiled. "You ever wonder if you're fighting a losing battle?" Cain leaned back. "All the time." She smiled softly. "But you fight anyway." Cain sipped the coffee, the bitterness a little easier to bear now. "It's not about winning every time, it's about keeping them honest, one truth at a time." End of chapter 1.